I'm EZRAH Raya. This is the Manila Times. Summer is officially here. The Philippines' warm and dry season has arrived, and we can really feel the heat everywhere. How can we protect ourselves in this boiling hot weather? Joining us now is public health expert and health reform advocate Dr. Tony Leachon. Good morning, Doc. Pag-asa had issued an extreme heat danger alert in some parts of the Philippines, some parts even reaching up to 47 degrees Celsius. So what are the things we need to watch out for this extremely hot weather?
The first thing that we need to understand is how to recognize that a person is on the verge of developing heat stroke. Um, there are certain manifestations that we can actually look into, and there are also three stages before we reach the severe heat stroke. And the first one is actually heat cramps, where you develop muscle weakness, and of course, pain in the muscles and body weakness. But the second one may not have the loss of consciousness. We call it heat exhaustion. The patients might have confusion, um, fainting, um, headache, nausea, shortness of breath, and fever. While those patients with heat stroke may have catastrophic consequences. They may have low blood pressure, they may have increased pulse rate, they may have loss of consciousness, um, difficulty breathing, and chest pain. And this would be catastrophic for those patients on the vulnerable in the vulnerable population. For example, patients who are elderly and those with comorbid conditions like diabetes, hypertension, cancer, or with chronic kidney disease. And the other extreme of the populations, the younger ones, and basically this would be infants to adolescent, basically because they're naive or clueless as to the manifestations of this heat stroke. So these are important things that we need to understand, because while we would like to enjoy the summer period and the summertime after the pandemic, sometimes a catastrophe or bad news may actually happen because of the lack of information related to this medical condition. Um, well, we can still prevent this by knowing first uh, who is at most at who is more at risk. This is more important. The older individuals are more predisposed to development of a heat stroke, basically because of their low immune system. Number two, because of their marginal cardiac reserve, and they have cardiovascular conditions um, brought about by aging, and this may actually predispose them to develop complications like stroke, heart attack, or acute kidney injury. The second are the children, basically because of the lack of knowledge that the manifestations may actually be fatal. A few days ago, we heard about the story of a an adolescent who played football in a big school and succumbed to this particular condition. Um, we can see also this in healthy individuals, those exposed under the heat of the sun. For example, you have riders, you have traffic enforcers, you can have athletes. The one reported in Davao, a triathlon athlete. So it's basically the profiling of patients should be there. People with disabilities, outdoor workers, and those people with certain chronic medications, like for example those taking diuretics or water pill. So they may take this during the hot summertime, and this may cause dehydration and low blood pressure. Or patients taking a lot of alcohol, which can also predispose them to dehydration, or too much coffee, caffeine, that may actually cause this problem, or energy drink. These are the people that we need to be on the lookout. Now, the other problem is about prevention. Um,
Yes, sir, tinamaan
Time
ako.
and
Tinamaan ako dun sa kape because even if it's boiling hot outside, I still like my coffee hot, ano. So sir, you mentioned na nga po yung sa fatigue, cramps, exhaustion, and stroke, at saka sino po yung mga at risk. Pero diba po minsan kasi mahirap kasing iwasan na hindi lumabas because katulad po ng sinabi niyo, may mga workers, yung mga riders, yung mga athletes, especially the ones in the field, at saka yung mga nagtatrabaho din po, yung mga estudyante natin, meron na ring heat stroke sa ilang classrooms na walang air conditioning. So, how do we prevent this, Doc? Especially kung di natin maiwasan na lumabas talaga, or dapat po ba hindi na lang lumabas kapag sobrang init?
hindi naman. Ang question lang, there are, I think, three reasons why we fail in health and other medical problems. The first reason is ignorance. So education is key. Kasi hindi mo alam that it may actually hurt you. So we need really massive public education campaign. And perhaps it should also be in the curriculum of the grade school and high school, because it can happen during the physical education activities. It can also happen in the workplace. So therefore, the HR group or the company physician should be able to issue out medical bulletins on how to prevent that. Local government units as well. I think we need to understand that. The other reason is ineptitude. Knowledge is there, but we fail to comply correctly. Alam natin na masama under the heat of the sun, pero sige lang, pero wala tayong heat stroke prevention. The last is the lack of a blueprint for change. Some of the things na nangyayari sa atin ay paulit-ulit. Like for example, alam natin masama manigarilyo, alam natin masama ang uminom, and yet ginagawa natin ito. So, kailangan may plano. So let's say the oil spill, nangyari na yun sa Guimaras, and yun nangyari ulit sa Oriental Mindoro. Ba't nauulit kasi siya? So meron template siya. So, ako, I need to inform the public that there's a time naman of the day na talagang delikado. 10 a.m. to 4 p.m. under the heat of the sun. This is the time na talaga napakainit. And mataas dito ang level ng ultraviolet rays. So stay away from direct sun exposure from about 10 a.m. to 4 p.m. I think we need to do that. We need to do infographics. We need to educate through the traditional media channels. The other one is avoid exercise during the hottest part of the day. So there's nothing wrong with exercise, but we need to understand it may be the early part of the day or at the latter part of the day at the sunset time, rather than the vulnerable time, which is 10 a.m. to 4 p.m. We need to eat light food. Basically kasi pag masyadong heavy yung food, yung metabolic heat kasi mataas din kasi you turn to burn more. And then before leaving the house, we need to drink plenty of fluids and then bring along water din. And then wear sunscreen or magsa-sunblock tayo. And wear light-colored loose clothing and sunglasses to protect the eyes as well. Because in the long run, pag hindi tayo nagkaroon ng ganitong thinking process, merong mga chronic conditions that may actually hurt us, like skin cancer. Hindi lang naman mainit ang Pilipinas during the summer period or the whole year round. Because of the climate change, makikita natin yan. So we need to protect ourselves from the heat of the sun because of other chronic illnesses. And then never leave a child in a parked car. These are isolated horror stories, no? Naiiwanan yung mga bata inside the car or in the beaches, kailangan din may kasama because drowning may be a problem as well. Maraming nababalitaan tayo doon. Marami rin mga bata walang kasama during the time. So these are important things na we need to understand. So 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 again, stay indoors as much as possible kung lalabas tayo. But and air conditioning is not available, stay on the lowest floor and out of the sunshine. Again, wear lightweight and light colored clothing. Drink plenty of water regularly, not alcohol or caffeine. Avoid eating foods with high protein content, as mentioned, which can increase the metabolic heat. And avoid drinking liquor because it can dehydrate the body and predispose to other problems like accidents or drowning pagka-altered yung mental state natin. So those are the preventive tips. But just in case, andyan na, meron na talaga nagkaroon ng loss of consciousness and it's an emergency. And you know naman in the Philippines, the farther you are from the National Capital Region, there are less health human resources, the less clinic. So therefore, one of the things that they need to understand that when they go to the beaches, ang probability of medical health mas mababa doon. So they must be empowered on how to do that. So the first thing is have the victim lie down and then apply cold compress from the head to the foot, from the head to the neck to the axillary region to the groin. And then use a fan to lower the temperature. So kailangan yung paypayan. And then have the victim drink fluids kung gising siya. Because kung tulog siya, it may cause aspiration or mabilaukan. And then elevate the legs because steady ang pulse dyan, mababa yan. In no time at all, pag ginawa ito in 10 to 15 minutes, the patient will be revived. But in case the patient would not respond to these emergency measures related to the heat stroke, they need to bring the victim to the nearest health facility for further management and administration of intravenous fluids. Kasi yun lang yun eh. Kasi you want to prevent acute kidney injury or those patients with pre-existing comorbid conditions to reduce the burden of stroke or heart attack. These are the usual things eh. Infrastructure-wise kasi, if going to take this on a personal level, yun ang sinasabi natin. But I think the DILG, the Department of Health, the tourism industry, we know that there will be a long summer vacation triggered by the Holy Week. I think we need to install medical clinics along the way or perhaps advise the destination areas at least man lang may nurse and may fluids because it will be very difficult kung magkaroon ng emergency na wala. I have witnessed in Boracay, somebody nag-arrest while playing beach volleyball. Ang tagal ng support. Several years ago yon, and we heard also stories like ang tagal madala, let's say, from Tagaytay to the nearest first-class hospital kung sakali mag-heart attack. So, we need to understand yun. For those who will engage in physical activities during the summer period, have yourself checked man lang by a doctor para may clearance eh. We heard stories that during pick-up volleyball or basketball games, nagkakaproblema. Tapos usually under the heat of the sun. Kung walang proper clearance yan, mahihirapan tayo. So these are things that kailangan natin. Kasi sa atin, prevention is better than cure. And it's important na we have the mindset na let's enjoy the summer period after the pandemic. But let us also be safe for our kids and our family and our workplace colleagues.
Thank you so much for your tips, Dr. Tony Leachon. And one of those tips, isa na doon ay yung staying away from the sun or staying indoors from 10 a.m. to 4 p.m. when the UV rays is highest or when the heat is at its boiling point. So 10 a.m. to 4 p.m. we should avoid the sun, and then andyan na rin po yung staying hydrated and wearing lightweight clothes and light colored clothes. at saka eating light meals, ano po. And then even when the heat stroke was unavoidable, we need to lower the temperature of the person who's having a heat stroke. Ayun. Maraming salamat po, Dr. Tony Leachon, a public health expert and health reform advocate.